I'm fine. So, how can I help you today?
I want morning after pills.
You want morning after?
Yes.
Okay, all right. And have you ever been on any contraceptive before?
No.
Never.
Yes.
Okay, and how old are you?
I'm 18.
And 18, okay. Why have you not been on any contraception?
No. Like it's complicated. I wasn't ready and I didn't have advices. Yeah.
Okay. When you say you were not ready, you mean you were not ready to have sexual intercourse, or you were not ready to be on a contraceptive?
On the contraceptive.
On a contraceptive.
Yeah.
But in terms of being sexually active, do you feel you were ready to be sexually active or not?
I wasn't really ready. Yeah.
What made you decide to do it?
No. I don't know. Oh, I don't know what to say. Yeah.
Do you feel you were under pressure by your boyfriend, or
No.
you were under pressure by your friends, or you just felt you're 18, it's time now?
But maybe it's time.
Yeah.
Yeah.
Okay, all right. And you know that when you're 18, even though you may look like a woman, you know, you're tall and your breasts are formed and everything, you're actually not fully formed yet, no? You're only fully formed after 21. You're an adult after 21. And some parts of your body, like your cervix and your vagina, are not completely fully formed until after the age of 18. Are you aware of that?
I wasn't aware.
Yeah. So I think, look, it's your first time having sexual intercourse, and it's a decision that you've made. Of course, if you're comfortable with it, you know, you said you were not ready, but if you feel, you know what, I want to continue, I actually don't mind, then what we need to do is, first of all, we need to protect you from HIV. You know? So you need to use a condom. And then another thing we need to protect you from is pregnancy. Even though you're an 18-year-old, but you're still technically small, and I'm assuming you're studying now. Are you here studying? Yeah. So you don't want to go home with a baby instead of going home with a certificate. So you said that you're not using any contraceptive and you don't know much about it. Is that why you're not using contraceptive? Do you know a lot about it, or don't you know much about contraceptives?
I don't know much about it.
Okay. Have you never spoken to anybody, your mom or your sisters?
I don't have a sister.
You don't have a sister?
I'm the only child.
You're the only child. And mama?
Yeah, I do have a mom. But we haven't talked about it.
You haven't spoken about it. Have you ever asked her?
No.
Okay. Have you ever spoken to mama about sexual intercourse? Never. Okay, now that's fine. Have you ever Googled or looked on the internet? Do you have access to internet?
I do have access to internet.
Have you ever looked on it?
Yeah, I have sometimes.
And what did you gain from it?
Yeah, the information was complicated. I didn't understand it. And so I need to consult a doctor to help.
Yeah. What didn't you understand from the information?
Yeah, it was complicated. Yeah.
Tell me what you at least benefited. What do you understand from the little bit that was complicated? What can you tell me you at least sort of understood?
Preventing will help me. Yeah.
Help you with?
Will save me from being pregnant and being HIV positive. Yeah, and many sexual transmitted diseases.
Okay.
Yeah.
What type of prevention is going to help you to be HIV negative, to stay HIV negative? A condom.
Yeah.
Okay. All right. So if you know about the condom and you're here now because you want the morning after, does it mean you didn't use the condom, or did the condom burst?
It burst.
Oh, it burst. Okay. All right. And what else did you learn about the types of contraceptives on the internet?
I didn't really look at it. I didn't really look at them. I just look at them the condom only.
At the condom only?
Yeah.
Okay. All right. So we've got different types. There are injections. There are tablets. And then, of course, we've got others such as your loop and also your patch. So for young people, the patch is the one that's like almost like a bandage that you put and you change every second day, 7 days. But for somebody as young as you, I think something like an injection might be a good idea, especially if you're not comfortable walking around with the tablets all the time. But what I'm going to say to you is that it's so important for you to take control of your reproductive health. When we talk reproductive health, reproductive and sexual health, it means a young woman should not have children when they are not ready to have children, especially because we've got contraceptives, all sorts, and they are also free when you go to government clinics. So you don't have to feel like, oh, I need to have money to be on a prevention. Another thing about reproductive health, it means you need to be in control of your type of sexual practices, how you will have sexual intercourse, when you will have sexual intercourse. So in other words, when you want to have sex and somebody doesn't want to have condoms on, you as a woman can actually still have a condom as well. You know about the female condoms, right? We do have them and they're free. Excuse me, in government.